Okay, number 19. Number 19. So, what medication can you use to treat onychomycosis, which is a toenail fungus? Starts with a T, terbinafine. What other medication that starts with a T can cause heart dysfunction that resolves when you stop taking this medication, for most patients anyway? Trastuzumab. Hypochromic microcytic RBCs on the peripheral smear. What is the number 1, 2, and 3 differential? Iron deficiency anemia for sure. FYI, Streptococcus pneumoniae is associated with community-acquired pneumonia. What sort of epidemiology thing is used to study means between several groups? Analysis of variance, right? Analgesics, like over-the-counter pain medications, can be used to treat what? Can cause what? Renal papillary necrosis. What sort of poisoning inhibits acetylcholinesterase, leading to cholinergic toxicity? Organophosphate poisoning. What is a sort of herbal-like medication that is used to treat BPH? Saw palmetto. And what is a side effect of saw palmetto? Bleeding, yep. How can you treat bipolar mania in a pregnant patient? Starts with an H. Haloperidol. What screening test with increased sensitivity is ideal? Sorry, trick question. So screening test with increased sensitivity is ideal. Bless you. Severe aortic stenosis is associated with what sort of heart sound during inspiration? A single second heart sound during inspiration. So severe aortic stenosis is associated with a single second heart sound during inspiration. And obviously, do you want to inform patients of risks, benefits, and any sort of pertinent info and get a consent before doing any sort of procedures? Obviously, yes. Your patient wants to receive a transplant. So what sort of things do they need to be screened for? Obviously, alcohol use, tobacco use, social history stuff, and support. If you have a patient with galactorrhea, what sort of intervention do they need? Trick question. Just a normal follow-up, right? A patient with galactorrhea just needs follow-up. Magnesium sulfate and hydralazine are used to treat what? To treat preeclampsia. If you have a patient with acute respiratory failure, what sort of intervention do they need? 3 things. Intubation, IV etomidate, and succinylcholine. If you have a patient with cardiac finding with echo on the patient and a PE, so what is the diagnosis? Tricuspid insufficiency, right? Diabetes mellitus is a risk factor for what sort of cardiovascular issue? Coronary artery disease. With epidemiology, you have 2 types of errors, a type 1 error and a type 2 error. What are their Greek equivalents? Type 1 error, obviously alpha, and type 2 error is a beta. Now of those, which is to detect an error, but there really is not an error? That's alpha. Oh, I'm sorry, and then what is to detect something to not detect something when there's a difference that actually is existent? That's a type B or type 2 error, and for that you need to increase the power of your study to avoid those. Okay. To manage hepatic encephalopathy, what is the first thing that needs to be treated? electrolyte disturbances, right? To manage hepatic encephalopathy, the first treatment is electrolyte disturbances. And to treat endometriosis, what sort of intervention do you want to use? Use a combination oral contraceptives. If you suspect pyloric stenosis in a patient, what sort of imaging should you get? Get an abdominal ultrasound, right? If you suspect pyloric stenosis, get an abdominal ultrasound. For pyloric stenosis patient management, what is one of the first things that is often, tested? Electrolytes, right? You got to get their electrolytes corrected because they've been vomiting all sorts of stuff. The prophylactic treatment of what is associated with pyloric stenosis? The prophylactic treatment of pertussis is associated with pyloric stenosis. How do you treat cat scratch disease? Starts with an A. Azithromycin, right? Azithromycin is used to treat cat scratch disease. If you have a patient with metastatic prostate cancer, what sort of intervention would be beneficial to them? Radiation therapy, right? Patient with metastatic prostate cancer needs radiation therapy. Acute ischemic stroke can be treated with what sort of medication? It's IV and it starts with an L. Labetalol, IV labetalol can be used to treat acute ischemic stroke. And vaso-occlusive pain can be treated with what? Starts with an M. Morphine, IV morphine. If you have a patient with acute chest syndrome, that can be treated with what sort of medication? Ceftriaxone and azithromycin. If your patient has heart issues with activity, you should do an adenosine stress test, right or wrong? Right. If a patient has heart issues with activity, do an adenosine stress test if they are unable to do like regular physical activity. If you see a necrotic ulcer on a patient's skin, what should be on the differential that starts with an E and it's two words, e.g. ecthyma gangrenosum. If you see a necrotic ulcer, consider ecthyma gangrenosum. IV antibiotics help treat ecthyma gangrenosum, by the way. All right, get this. Your patient has decreased ADAM-TS13, and they have widespread microthrombi. What should be at the tippity top of your differential? And that tippity top definitely gives the answer away. Thrombotic thrombocytopenic purpura, right? And patients with impaired fasting blood glucose are at risk for what? And you got this question earlier. Coronary artery disease, right? Obviously, impaired fasting glucose leads to diabetes, and diabetes is associated with cardiovascular issues. Now, you have a patient that has rabies vaccine, and you need to boost her only if you contact with rabies. Else, if never vaccinated, get both, right? I'll say that again. Patients that had rabies vaccine need a booster only if in contact with rabies. Else, if they've never had a vaccine, they should get the booster and the vaccine. Now, if you have a patient with painless muscle weakness with increased muscle enzymes and inflammatory markers, is it likely to be an inflammatory myopathy? Yes, it is. You should get PFTs on a patient with diaphragm muscle weakness potential, right? Right. Home health assessment may be needed for a patient that does what a lot? That falls, right? You got to go check it out. And true or false? OCPs bind to TBG, which decreases the thyroid hormones, and so they need increased levothyroxine until the TSH normalizes these patients. True or false? It's definitely triggity true.